Very good evening, friends. Meeting again in the session of philosophy, and we're discussing a 27th chapter, that is the Syphilitic Stigma Continued from H.A.Robert. This was second consecutive chapter on the syphilitic miasm. Earlier chapter, he has mentioned about he has mentioned about the things regarding the syphilitic miasm. Every organ, how the syphilitic miasm gets expressed. That's the thing which he has tried to explain over there. But in this chapter, he has tried to compare the miasms. So syphilitic is compared with Psora. Syphilitic is compared with Psoro-Syphilitic, that is tubercular miasm, and how it varies. So Psora, when you consider the Psora, it's clearly functional. When it happens to be syphilitic, it is more structural. But when it is tubercular, that is the combination of Psoro-Syphilitic, where you get the structural manifestations with the functional manifestation. So structural changes with functional manifestations is the characteristic of the stigma. And that's why in tubercular miasm, you have ample symptoms along with the pathology. So if the patient is suffering from the specifically a liver problem, liver pathology, liver cirrhosis, and he might have many varieties of symptoms along with that. Definitely, it belongs to this tubercular miasm. Or there is any brain pathology associated with lot of symptomatology, then it is definitely have a tubercular focus. So tubercular miasm has this specific entity. The characteristic is that structural changes associated with functional manifestation is the characteristic of it. Last paragraph which we have discussed is related with the heart complaints, and where he has tried to explain how the Sora presents only the functional manifestations of the chest. He comes to you again and again checking his blood pressure. He says that there are many varieties of symptoms in the chest. His hand always goes toward the chest, always goes toward the heart. There is always a palpitation. He gets excited, panic because of that. These are very typical functional manifestations without having any structural damage. And that's why these people, the psoric persons remains alive for longer time of duration because they don't have structural changes. When you deal with the specifically those venereal miasms, the psychotic and syphilitic, in them symptoms are very less. There are no warning signs. Patient presents directly with a valvular heart trouble. Patient presents directly with the coronary obstructions. You get all those symptoms and patient is all of a sudden off without any warning sign. It itself suggests that those patients are always suffering from the structural changes, and those are the results of these venereal miasms, psychotic and syphilitic. So on this note, we have finished yesterday the topic. We were there on page number 220. Let us go with the last paragraph, last line of this page. Lymphatic involvement of the abdomen is of tubercular origin, as are the hernias. The muscles lacks the tone. Very important feature. Mesenteric lymphadenopathy, most common. And mesenteric lymphadenopathy is generally related with this tubercular miasm. So, lymph node enlargement itself is always a tubercular miasm. When cervical lymph nodes are enlarged, it is always considered to be a tubercular miasm. But here he has explained one more thing, that the muscles lacks the tone, and that's why hernias, the abdominal hernias, the inguinal hernias, which are quite common, and they are having the tubercular miasm. Hereditary syphilitic troubles in children sometimes produce very watery discharge that almost completely drains the system of its vital fluids, and unless promptly corrected, death ensues. The cholera infantum types of diarrhea are syphilitic. So whenever the diarrhea is of very severe character, draining the whole system is always syphilitic. It is it is the diarrhea which immediately affects the life of the patient. The cholera infantum types of diarrhea are syphilitic. We often find tubercular diarrheas which simulate the cholera infantum, but they do not as rapidly drain the system. So there is a difference between syphilitic and tubercular diarrhea. In specifically tubercular diarrhea, it is a mixed miasmatic trait. That's why functional symptoms, warning signs are much more, and they never drains the system so fast as the syphilitic drains. And because of which death ensues in syphilitic miasm, which is not so common with the tubercular very easily. In the tubercular diarrheas, we find the aggravation in the night or early morning, driving the patient out of bed, and aggravation by cold, showing the syphilitic relationship. The tubercular child often cannot assimilate cow's milk in any form. Underline this. This is very important. The children cannot tolerate the milk in any form, specifically the cow's milk in any form. It is indigested. The casein has to be modified before it can be digested at all. These are the children who have undigested curds in the loose stools. So it's like a Ethuja picture, Ethuja synapium, where you get the curdled vomiting or curdled stools. And this is tubercular miasmatic focus. So you must know when you read the remedy, you must think accordingly so that you can immediately correlate it. Generally, these diarrheas are aggravated at night. Here, the syphilitic dominance, you can find it out over there in tubercular patient. And one more feature, aggravation by the cold is one feature of the psoric miasm. There is a close relationship between the ability to take the lime salts from the food and these diarrheas of the tubercular children. This is the reason for the difficult and irregular dentition and the craving for elements which the body needs. They cannot assimilate necessary elements from their food. So there is a problem of assimilation, losing flesh while eating well. They cannot get what they desires from the food, and that's why there is a deficiency. So that starts getting certain cravings for indigestible things. One of the important manifestation of this miasm, and these children, they crave the pica, they crave the mud, they crave the pencil, they crave the chalk. These are common features which you can find it out. The diarrheas of syphilitic child who is strongly tainted with psychosis will probably call for some such remedy as croton tig or sarsaparilla. So syphilitic diarrhea, croton tig is one of the important remedy where there is a forcible expulsion of the stools and it is more toxic, and that's why it is called to be a syphilitic diarrhea or syphilitic dysentery. The tubercular stool is apt to be slimy, bloody, with a musty, moldy smell, nausea and gagging before the stools, and prostration with a desire to be left alone after the stool. It is the bacillary dysentery which is very common with these people. It is not a amoebic dysentery, it is bacillary, where the blood is there, where the pain is there, where the spasm is there. So these are very common features which you will get associated with nausea and gagging. Prostration is another important thing which follows the dysentery. Very important feature which develops after the dysentery. Prostration with desire to be left alone after stool. They don't want to get mixed. They get so prostrated, they want to be alone over there. This is the future, the exhaustion of the tubercular miasm. Hemorrhages from the rectum are signpost of tuberculosis, although there are bleeding hemorrhoids in psychosis. Generally, it is a tubercular feature, not psychotic. Psychotic, there is engorgement, but bleeding is not so severe in psychosis. Tubercular miasm, this is definitely there. In tubercular miasm, lot of bleeding, and you might require many times as an intercurrent the tuberculinum over there, and it stops that bleeding. Many times I have successfully used tuberculinum as an intercurrent over there. Someone is pushing the whiteboard over there. Suggestion is that you should not interfere with the lecture. Hemorrhages from the rectum are signpost of tuberculosis, although there are bleeding hemorrhoids in psychosis. Tubercular patients are troubled with pinworms and sitworms. This is again very important. Entrobius vermicularis. Pinworms, very common with this miasm. So you require many times this. This is a psoric manifestation of the Psoro-Syphilitic miasm. The characteristic alteration of the symptoms in the tubercular patients may be noted in the alteration of rectal diseases with heart, chest, lung troubles, especially in the asthma and respiratory difficulty. So there are alternating symptoms. Alternating symptom is the signpost of tubercular miasm. So chest symptoms alternates with hemorrhoids. Sometimes skin symptoms alternates with rheumatism. So there are alternating features. If there are any alternating diseases, must think about this miasm. This is the characteristic. So many times it is the heart symptoms are alternating with the chest symptoms, or heart symptoms are alternating with the hemorrhoids. That's what we used to get over there. Very often, operated or suppressed hemorrhoids will be followed by asthmatic manifestations. So see, very often operated or suppressed hemorrhoids will be followed by asthmatic manifestation, often accompanied by heart trouble. So patient who is operated for hemorrhoids all of a sudden develops chest symptoms, all of a sudden develops heart symptoms, and go patient is going in wrong direction. He is going from less important organ to the more important organ because you have tried to remove the external manifestation by means of scalpel. So such types of effects happens when you go for surgical intervention. I have seen many times that there are some malignant tumors are there, and without starting any internal medicine, they start going for surgery. After surgical removal of them, the disease immediately goes to the very vital organ and metastasis develop. Because you when you try to suppress the things, the disease is not cured. Disease remains as it is. You are removing just external manifestations with the help of local treatment. So such things always disturbs the case. In the rectum, strictures, sinuses, fistulas, and pockets are all of the tubercular origin, but these conditions are much more frequent and in much aggravated form when combined with psychotic stigma. So, fistula in ano, very typical tubercular manifestation. If there is a pus pockets, opening is there outside in the form of sinus, it is again a tubercular manifestation. So these are stricture of the anus because of because of the recurrent straining of the stool. So these are all tubercular. But many times, if carcinoma develops over there of the rectum, it is always a mixed miasmatic. All three miasms comes together in carcinomas. So it is not single miasm which takes part in the development of CA rectum. Few remedies we forget in CA rectum. One of the important remedy one should not forget is ruta. There is one sentence in Borix Mater Medica. Carcinoma affecting lower bowels. This is the sentence which has been mentioned. Generally, we never take into consideration ruta as a depicting remedy. We used to think it is a rheumatic remedy, but no, it is a cancer miasm remedy, psychosyphilitic remedy. Nitric acid is one more remedy which you can think of at that level. So accordingly, see the miasm and remedy. When you compare, then you understand the importance of it. Cancerous manifestations of rectum are combination of the tubercular and psychotic, means all three miasms. Tubercular means Psoro-Syphilitic plus psychotic, all three miasms. In other words, they are manifestation of combined destructive force of the three stigma. Psora alone never reaches the pathological changes. Yet without psoric element, malignancies will never develop. See, this is a controversy or controversial statement. First sentence is that Psora alone will not going to produce any carcinomatous change. But when without Psora, the carcinoma cannot develop. So Psora is always in background. Rest of the two miasms when gets involved, when gets attached with the Psora, then it definitely produces such types of carcinomatous or malignant changes. Generally, Psoro-Syphilitic miasm is tubercular, but psychosyphilitic miasm is definitely a cancer. But Psora is always in background, and that's why all three miasms takes part whenever any malignancy has to happen. So this controversial statement, one has to understand that Sora alone cannot produce a malignant change, but at the same time, Sora is required to produce a malignant change along with the rest of the miasm. There is one question asked by Satyanarayan sir. Ruta in this case should be given in high potency or low, always, and also the repetition. Ruta you must give in 30th potency. It is better potency to be utilized whenever the malignancy is there. And you can repeat till the action develops. One practical point which I have learned in my practice that when you give and repeat the Ruta, when patient starts getting the headache, then it indicates that Ruta has acted. Now it is time to stop the Ruta. This is a common thing which I have observed in many patients when I have repeated the Ruta. So when you stop the Ruta, the headache stops, and Ruta, it will work for that patient. Okay. So this is one more important thing which we have learned, that psoric alone cannot produce the malignancy, but without psoric, the rest of the two miasm cannot produce malignancy. Now he turns towards the urinary tract. In the urinary tract, all of the stigmata may manifest themselves, but most frequently these manifestations are psoric and psychotic. See, very important thing which is explaining, urinary tract affections generally considered to be a psychotic, but it is not so. They are either psychotic or they Psoro-Syphilitic. Sometimes it might be a three, all of three. Here also the combined assault means halla. Here also the combined assault of all three stigmata are represented in the malignancy. The diabetic patient is, as a rule, strongly tubercular. Underline this. These are very important themes. Diabetes is always psychotubercular. Sometimes in this condition, there is strong taint of psychotic, which makes the condition much more malignant. So what he is explaining has a meaning. He explains over there that diabetes is tubercular, but it is not purely tubercular. It starts with psychotic and ending with tubercular. So psychotubercular, always keep it in your mind that diabetes is psychotubercular. So remedies, when you think about the constitutional remedies, should be have that miasm in the background. We never see marked tissue changes or fibrous growths without the presence of three stigmata. Although the tubercular and psychotic are represented in majority of cases of Bright's disease. So what is Bright's disease? Bright's disease is nothing but the glomerulonephritis. So nephrotic syndrome, nephritis, whenever happens to be there, it is always a psychotic or psychotubercular presentation. While the psoric element is present in this condition, it is not as in as marked degree as syphilitic and psychotic. See, he is explaining very clearly about the miasm over there. And he says over there that without all of three, it is not possible to produce deep pathological problems or structural changes in this urinary tract. One more feature is related with this nocturnal enuresis, that is bedwetting, with aggravation during sleep and soon after falling asleep are tubercular. So early part of sleep, if nocturnal enuresis is there, it is tubercular. And nightly emissions are also combination of syphilitic and sori. So pollutions, that is another word which you can get in repertory. Pollutions, they are Psoro-Syphilitic. Usually, prostatic troubles may be classed under the union of these two stigmata. So, prostate enlargement is again a tubercular. So, see, wherever you get the glandular enlargement, it is always tubercular. So, prostatic enlargements, breast enlargement, tonsillar enlargements, adenoid enlargement, so thyroid problem, all are having the tubercular miasm in background. So when you think about treating such conditions with homeopathy, you have to think about this miasm and remedy from that miasm so that you can achieve the cure. Pollution is the word for the seminal emissions. That is the word which is mentioned in the repertory. Pollution is the seminal emissions, night falls. So that's all for today. We'll conclude over there on this note. Tomorrow it depends. I will let you know whether to take lecture or not. It depends on the situation. But most probably we'll continue with it. If it is not, then we'll meet on Friday. I will let you know regarding the lecture of tomorrow. So thank you being there and we'll meet mostly tomorrow.
Thank you very much, sir.
Thank you, sir. Thank you.